So I'm happy to say that just recently, I marked the 1-year anniversary of starting this YouTube channel. And I couldn't be more grateful to anyone who's watched the video, left a comment, liked the video and subscribed, or just stuck around to learn something in one of my videos. Thank you so much. So in today's video, I wanted to reflect on this channel and answer some questions a few people have asked. I hope that in some way, maybe my story is also inspiring to you. Because 2 years ago, there's no way I would have expected myself to be sitting on a weekend talking to a camera about mental health. So let's dive in. And for those of you who are new to the channel, welcome. I'm Dr. Robert. I'm a board-certified psychiatrist. I usually start my videos like this, but maybe today's will be a little bit different. Here, hold on. Here we go. All right. So yeah, I think this informal setting better suits today's video. This is my little friend Bubby. He's so cute. Long before I wanted to have a YouTube channel, be a psychiatrist, or even become a doctor, my goal was becoming a writer. Because early on in high school, I fell in love with reading, with storytelling, with prose, literature. So I wanted to become a writer. But I really appreciated medical writing. I like doctors like Oliver Sacks, Atul Gawande. So these authors who wrote about medicine, about their interests in that field. So in residency, during my psychiatry training, I actually started working on a book. I was putting together a memoir of psychiatry residency, the different cases I was seeing, of the incredible world of psychiatry that really just never ceased to fascinate me. I also wanted to teach people about some of the conditions within mental health. Some very misunderstood conditions like catatonia, bipolar disorder, schizophrenia, OCD, and many others. And then the time came around to try to turn this into reality. Try to turn all these drafts, all this work into an actual book. So the first step was looking for an agent, looking for a publisher. So I was sending out dozens and dozens of inquiries, and not much happened. Either I got no reply at all, or I would get the same reply. You're not a well enough known person. Nobody knows you. You're a doctor, that's kind of cool, but who cares, right? Like, you're just a resident. Many people want to write books like this. You don't have an audience. You're not a known person. And fair enough. I wouldn't expect a publishing house that's already a tough industry to take a chance on some resident out there. That kind of made sense. I also began to realize that nobody really reads. Sure, I read every day, but I don't know a single person that reads every day. So even if I did publish this book, it did reasonably well, not many people would read it or learn from it. And so I realized that wasn't a very effective means of communication in the modern world. And that was kind of a setback. That definitely hurt. I think that took me away from that work for a little while. But then I did have an idea. People watch videos. So I knew there was an audience there. People were engaged in that. But I'd never made a video. I've never been on Instagram. I don't use Facebook. I don't use all these social media platforms. So I didn't really envision myself potentially doing any of that. And if anything, I'm more of an introverted person. So the idea of talking to a camera, of putting myself out there online, was definitely not appealing. And I had a lot of hesitation. But this little kernel of an idea did come up. And it was, maybe you should turn these essays into video essays. Pulled out a camera and I started filming myself. And it was terrible. It was god-awful videos. God, I never posted those. But I didn't stop. I just kept trying to work at it, speaking to a camera. At least I'm still trying to figure out how to do that exactly, how to make videos. But at least I started somewhere. After a while, I figured, okay, these are good enough at least to maybe post and see what happens. And now I'm at a year of posting weekly videos, believe it or not, which is pretty incredible that I've persevered and continued to enjoy this. And now I'm realizing people are watching it, which is pretty incredible. And so a few people have asked in the comments, what's my goal with the channel? And I guess initially I didn't really have a goal other than let's turn some of my essays, some of the work I was doing there, into a video format that's more condensed, shorter, right, 10-minute videos, and just seeing what happens. So I made videos about involuntary psychiatric hospitalization, treating schizophrenia, bipolar disorder. So these really severe mental illnesses I wanted to portray in a realistic and hopefully educational way as well. But as I was doing this, I was also specializing more and more in OCD. So how did that come about? Well, the funny thing is I never had an intention of becoming an OCD psychiatrist. When I went into residency, into my psychiatry training, my goal was actually to be an inpatient doctor, work in a psychiatric hospital, and treat very acute, very severe mental illness. What appealed to me about that was, one, I just found the conditions fascinating. I really found it gratifying to really help stabilize people quickly. I also enjoyed the fast pace. I loved the intensity of it. So that really appealed to me too. But as I started going further in my psychiatry training, I also found a great joy, great fulfillment in seeing more people more longitudinally. And I started really to get into psychotherapy. And the program I trained at was very, very keen on teaching all of its residents, all of the psychiatry trainees, to be very good psychotherapists in addition to psychopharmacologists. So being a good doctor that both can provide quality therapy and medication management. not one or the other. It was towards the end of my psychiatry training, where I started working closely with one of the top OCD psychiatrists in the country. They actually for the first time ever, started to recognize what OCD was. I really started to conceptualize how it affects people and just how commonly it's misdiagnosed. I started to look back at some of the cases from earlier in my training where I was like, oh my goodness, I was trying to treat this or that and I thought it was this, but actually with hindsight, it was probably OCD. I didn't catch it. And many other mental health professionals with more training than I had also didn't catch it. So that made me start to recognize there's a huge need for OCD providers out there. And I was just generally fascinated with the many ways that it can manifest. I also started to recognize how terrifying it could be for people to experience this and how gratifying it was to help them through it, to help them recognize that, okay, things will get better and here's how. So then in my residency, I pursued further training in OCD treatment. And so I started developing more skills in treating OCD, learning more, taking more courses, becoming more adept at treating this condition in particular. And over several years, as I left that practice, started my own private practice, and I've continued to develop a larger OCD panel of patients, become more astute at treating this condition. It's just kind of blossomed from there. And so naturally, the content of my videos started to niche down. I started to make more videos on OCD and anxiety. That's kind of my goal for the foreseeable future as well, to cast more of a light on this condition, to provide more education as to what OCD is, the misunderstandings behind it, and the effective treatments for it. I want to give you a glimpse into my mind as an OCD psychiatrist and as to how I approach these cases. And then nobody's asked me this yet on this channel, but there's also the question of why do I tell patient stories? How is that even allowable, right? Because I have a lot of videos on my channel where I talk about a specific patient, a case, and kind of walk you through that. And that's kind of the anchoring point throughout the video, like the scaffolding on which I educate you about OCD, anxiety, or other mental health conditions. Well, the reality is these aren't actual cases, right? I'm not going to tell you about a case that would breach HIPAA, I would lose my license. That's not allowable, and for good reason. Rather, these patient stories are accumulations of many clinical experiences I've actually had. So a case I talk about might come from a dozen different OCD cases, a dozen different cases I've seen in the hospital, with details changed, facts changed, and different cases blended together to create a cohesive narrative. And why do I do that? Well, one, it of course definitely protects patient identity. Two, I recognize as an aspiring writer, or maybe previously aspiring writer, narrative as humans is the thing that most translates into deep understanding, or how we as humans best remember things. It's how we best resonate emotionally with concepts, because that's just how innately as humans we learn. We learn from stories. And so I think it's critical that going forward, I also put in as much storytelling into these videos as I possibly can, because I think that will most resonate with people. I'm still working on trying to figure that balance out. I've spent most of my life writing short stories, attempting novels, or writing essays. So I'm still working on how to translate that into the video format. But maybe in the next few years, I'll be a little bit more effective at that. You let me know. So pretty much in the last 16 years of training and clinical experience, a lot of things have changed. A lot of unexpected turns have happened. And they've all luckily kind of worked out for the best, at least thus far. And I'm really excited, really eager to see where, curiosity, creativity, and just wanting to share my interest with others takes me further. And I hope you come along for the ride. So if there's anything you want to pursue, anything you're kind of thinking of trying out that's a little bit new, uncomfortable for you, I hope this serves as some degree of inspiration to go ahead and at least give it a shot, or at least dip your toe into it. You never know what might come out of it. And thank you so much for watching this video. I know it's a little bit different than the other videos, but if you did stick around this long to the very end, I really appreciate you. Please consider liking and subscribing, and I hope to see you next week in another mental health video.